So, when did counseling stop being about problem solving? Well, not anymore. Introducing solution-focused counseling with the unlicensed counselor. And now, here's your host, Steve Moak.
Well, hello. So grateful to be here again. My name is Steve Moak. I am the unlicensed counselor. It is a beautiful day in Scottsdale, Arizona, and so happy to have you tuning in and spend a few minutes of your day listening to the unlicensed counselor. As always, got some interesting topics we want to get into. Let me tease it a little bit. I actually came up with the name of this episode before I actually came up with the podcast. Today we're going to talk about Rehab is for quitters, right? I spent almost 2 years working inside a treatment center. I'll give you a little inside look of what a day in the life at a treatment center actually looks like. But before we get to that, let's thank a couple people and pay some bills, as always, with our sponsors for ShareTech, right? The most trusted drug and alcohol screen available on the market. This test detects everything. If you think you have a loved one who is still using but is passing their drug and alcohol screens, highly recommend you get over to betterdrugtest.com. Buy one of the ShareTech drug tests. This is an amazing piece of technology that will not allow your loved one to continue to use and go undetected. So again, grateful to ShareTech, and go to betterdrugtest.com to pick that up. Then also our friends at EasySheets.club. Again, I sleep on these sheets. They're amazing. It comes cleaned, professionally cleaned and pressed right to my door every 2 weeks. I never have to wash my sheets again. And then trust me, there's a difference between putting them in your little loader at the house and what they do at the actual cleaning facility, from the agitation, the temperature, all of that stuff. Then you layer in that press sheet that you're getting into. Again, I always recommend to people try the Carrie Loha sheets. They're bamboo. They're my favorite. Big thanks to EasySheets.club. Sign up. I think you're going to be really happy with that subscription. Our friends at Stitch Fix. We're talking clothing. You'll notice if you're watching on video, we're going to short sleeve season here in Scottsdale, Arizona. It is a beautiful day in Scottsdale, Arizona right now. I think hopefully we've seen the end of long sleeve shirts and the unlicensed counselor from here on out. So Stitch Fix, come on, shoot a box over this way. Last but not least, I did have a few people reach out to me online. Go to theunlicensedcounselor.com. If you like what you hear, you want to talk a little bit more directly than maybe your traditional counseling approach, go ahead and book some time with me. I really enjoy, the podcast is great. This is just such short form. If we want to take it a little bit longer, if you want to really dig into solution-focused counseling, hopefully you like what you hear and you want to book some time with me. Please spend some time and do that. Okay, fantastic. I'm excited about this topic today. I get asked about rehab, drug addiction, treatment, all the stinking time. I mean, personally, I've been to treatment 2 different times in my career. Once when I was 19 years old, walked in the door of a treatment center here called Chandler Valley Hope, now just called Valley Hope. Really an eye-opening experience for me. I wasn't even of legal age to be drinking, but I was a full-blown alcoholic at that time and had a great experience there. And, fast forward to, you've heard my story if you've listened to the podcast, to when I checked myself back into a treatment center here in Scottsdale, Arizona. The place at the time was called Sundance. It became known as Promises down the road, and now I think it's actually gone away altogether. But so I went through treatment when it was Sundance and had an outstanding experience there. I wanted to be in treatment. I needed to get better. My life was in shambles, and I wasn't able to stop on my own, as so many can't. And I just knew that, a half measure, an easy step, maybe just an outpatient type of program wasn't going to cut it for me. My drinking and drug use was excessive. It was daily, and it was destroying my life. I needed a hard stop. Now, I'm going to lay out a lot of insider information on kind of rehabs today. First off, most rehabs aren't going to let you walk in the door if you've been drinking, like that day, right? They want to send you over to a detox. And what I didn't know at the time is the very first place that I went to in Chandler actually had a detox connected to the actual treatment facility. So this is somewhere where I showed up at the facility, I was twisted, high, flying on shrooms and all kinds of stuff, as well as drunk when I walked in the door there. And they actually detoxed me on site. And that is where they put you in a room, nothing that you can hurt yourself on, terrible little mattress. and they come and check your blood pressure and give you meds and basically keep you there supervised for 3 or 4 or 5 days, however long it needs to kind of get you through that time, because that's when people can have serious medical complications and things happening when they're detoxing. You just never know what somebody's on when they're walking in the door or their full medical history. And oftentimes medical history has gone untreated, undiagnosed, unattended to over the course of years or decades because people are so far gone in their addiction. So not all treatment centers, in fact, I would say most, do not have the actual detox facility connected to the actual treatment facility. So the one that I went to in Scottsdale, Arizona did not. So I went to, a psychiatric hospital, which was the right place for me to land at that time, mind you, because I was out of my mind. And they kept me there for 5 days. So I actually thought when I said, hey, I need to get some help, that I was kind of going to the treatment center and I was going to detox there. So it was a little bit of a surprise for me when all of a sudden I got dropped off at Valley Hospital down the road here in Scottsdale and had to spend some time behind bars, basically literally chain link fence, no slip socks. Everybody who's been through a treatment center knows those no slip socks all too well. I think I still have a couple pairs of those rattle around in my drawers. So, okay, we get through the detox. Now you're into the treatment center. If you're fortunate enough to get your loved one to say yes, to actually get into the treatment center, and I can't tell you how many stinking times I have people call me. They're crying. These are grown men, grown women, crying, bawling. I need help. I'm addicted. My wife's leaving my job. I'm losing it. I'm a mess. I'm addicted to X, Y, and Z thing. And I'm like, boom, like Steve kicks into action. This is what I like to do, right? This is just, I've been there. I know exactly where you're at. Let's get you to where you need to be. I make a couple calls. I reach out to some contacts in the treatment center, the detox, kind of case dependent on what exactly is going on. I get things set up, beds available, insurance or cash pay. Like, we're getting you in the door, right? We're getting you in the door. And as soon as it never fails. It never stinking fails. As soon as I get everything set up, we get the waffle, right? We get the, but my job, how well are you performing at your job right now? From what I hear, you sound absolutely terrible at it. You sounded like you should have been fired months ago. I can't believe that they've even kept you, right? Well, my wife and the kids she's going to leave you, and she probably should have left you already. The kids, I get it. That sucks, but you're not a good dad. You're not present. With the behavior that they're seeing at home isn't something that they should be seeing at that age or any age, really. So what I'm saying is I get that list, the list of excuses that just keeps rattling off to me about why I can't and should have, and maybe I can do this, or I'll go to me. Like anything but basically getting into rehab, when really the only place that these individuals need to be is an inpatient facility. So again, if you're lucky to get past that phase and you're able to kind of, maybe there's an interventionist, maybe there's some, you have one of those, 10-person interventions and that gets you there. I've had 2 of those, didn't work for me. Maybe it works for some other people. Mine wasn't on TV. Maybe if it was, it would have helped. But if you're lucky enough to get them in the door, let me just kind of share what it's going to be like, first day, couple days, mid, towards the end, some things and do's and don'ts as it pertains to rehab. So we get them in the door, they're detoxed, they walk in the door. Oftentimes, and this is going to vary, so please, all the treatment center people and friends on my Instagram and all that stuff, like, calm down. I get it. Not every single place is the same. But many times, they're going to go ahead and take your phone from you, right? That first 24, 48, maybe it's a week, depends on the facility, but they're going to take that phone from you. You're going to have limited access to be able to reach out to folks. You're going to be able to make a call or two to your mom, dad, husband, or wife. There's a reason why we do this. Again, I went from being in a patient in a treatment center to 12, 18 months later to actually going back and working at the same treatment center that I went through after I had demonstrated that I was doing well in my recovery and doing all the things I needed to do and staying sober, most importantly. So I'm speaking now as a staff member when I would be intaking patients into our treatment center. So we get them in the door. First off, look, I get it. You're addicted to things. We all were. Nobody lands at rehab on a winning streak. I got it. Can we just stop with the trying to sneak stuff in? I have to go through your stinking bag, or somebody has to go through your bag every single time. We know where you're going to try and hide stuff. We know the pills that you're going to try and hide. We know all the little tricks. We've seen it. You're not unique. Just stop, right? You're going to rehab to get better. If there's prescribed medications that are prescribed by your doctor with not one of these phony doctors or pill mills or something like that, and maybe they're actual medical conditions, there'll be a psychiatrist who will do an evaluation with you, and those will be locked up, and you'll be taking those and dispensed to you as prescribed, right? So let's just stop with that. Now back to the phone. You're going to be able to talk to people, but here's what happens. Everybody walks in the door, and I'm not going to say instantly regrets it, but everybody will try and talk to the staff about why they're different, why they shouldn't be here. You don't understand my situation. It was because of this X, Y, and Z circumstance, which is why I'm here, or I was abused, or I was neglected, or my trauma is the worst trauma in the world. We as staff members, and we're trained, we've heard it all. We don't want you AMAing, so against medical advice. We don't want you walking out the door. So a little bit of time without your phone so that you're not calling your boyfriend, girlfriend, husband, wife, dealer, whoever it is, or, having somebody, slingshot drugs onto the property where you can get, we've seen it all, folks. Literally this should be, a Netflix, documentary about this thing, because it is the wild, wild west when you get into these treatment centers things. So expect that you'll probably have to spend a little bit of time away from your phone. They're not trying to be mean. We're just trying to make sure we can kind of get you integrated into the flow of what a day in the life of treatment is going to be. Now, you're going to get your medication. Then you're going to see a psychiatrist, and they will prescribe you medication on an as-needed basis, right? And you don't just get to tell them what you want. Obviously, you have medical conditions. Those will be dispensed to you, like I said, as they need to. They will also evaluate you and see if there's anything else that you need to be taking given the condition that you're coming in at, and those will be dispensed at whatever frequency they need to be done. So you will be evaluated by a doctor. Let me also just say this. First couple nights, maybe even a week, sleeping might be a little rough, right? Just face facts here. What you've been putting in your body, the poison that you've been putting in your body, now that you're coming off of detox and now you're inside a treatment center, you're going to have thoughts, feelings, emotions. You may not have gone to bed without blacking out or falling asleep or passing out, and God knows how long. Expect that there might be a couple nights where you toss and turn a little bit, right? Sometimes you're going to have a roommate. Sometimes you're not going to have a roommate. Depends on the type of treatment center that you're going to. And look, you can spend $5,000. You can spend $50,000, $60,000 for a month stay and more at some of these treatment centers. Does cost make a difference? It makes some of the conveniences and luxuries there. Yeah, I get it. Are we going there to get better, or are we going there to get massages every day? Do you really want to get better, or are you trying to make someone else in your life believe that you want to get better? So I can't speak to the efficacy of the dollar. Do you get more out of this one? Do you get more out of that one? It's up to you. It's up to what you want to get out of that. I've seen people get sober and do outstanding at the Salvation Army, which is a free treatment center. And by the way, if you need treatment, the Salvation Army doors are always open. There's beds always available. Walk in the door there, get some help. I've seen just as good of outcomes from any type of Hazelden Betty Ford as with the Salvation Army folks. So just something to think about. Okay, you're in the door. You're there. You're sleeping a little bit. You're going to have some food prepared for you. Sometimes there's chefs. Sometimes there's a little more meals. Sometimes it's cafeteria. It depends on the type of treatment center. Oftentimes you're going to get assigned maybe a little chore. Many of us may not have done great with responsibilities. And I think it's great if you want to, maybe do the dishes or clean up the yard or pick up the cigarette butts or whatever it is. It's these little things of starting to kind of break old patterns and start to take some accountability and responsibility. Next thing you're going to do, especially early on, is be prepared for a lot of talking about yourself. Now look, oftentimes as drug addicts and alcoholics, we're selfish people. I think I've talked about this on previous podcast episodes. We can be super selfish folks. So what's the downside of talking about yourself a little bit more, right? I mean, these counselors want to get to know you. They want to hear what you've been through. Is it going to suck? Are you going to cry? Take a box of Kleenex in there with you, right? I get it. Like, it's tough. It's not only is it you're reckoning all of the stuff and maybe processing it for the first time in years that you've just done, whether it's, sexual activity, sharing needles, it's abuse that you've never told someone else, it's, the accident that injured someone else. I mean, STD. I mean, we see it and hear it all when you're working in a treatment center. But be prepared to start opening up about that, and also be prepared that it's going to emotionally kind of gut you. You're going to cry. You don't know why you're crying. Things that shouldn't make you cry are making you cry. And it's just this kind of whirlwind of thoughts and feelings and emotions that just kind of swirl, and you almost just kind of makes you dizzy in a sense, because you're sitting down here and you're talking about stuff that you need to be talking about that you haven't addressed in God knows how long. So be prepared. You're going to have a counselor. You'll probably be going into some group counseling sessions as well, too. There's going to be probably a little bit of journaling or writing exercises, or maybe even some arts and crafts. Look, we get it, Mr. Big Shot, when you walk in the door of a treatment center and you don't want to be putting, cutting the little magazine images out and gluing them on cardboard paper because it feels like kindergarten. Maybe that's what you need right now. Because again, you're right here next to, me, the guy who's crashed and burned at 19 years old, even though you may be some hotshot attorney or business exec or whatever. Like, we're all in the same place here. So being able to check that ego a little bit is going to be key. It's not only going to be key just for getting better in treatment, but just in recovery in general, is being able to kind of make sure that we have that ego in check, which is much easier said than done. Keep an open mind. You're going into an uncomfortable environment with a lot of people that are going to ask you to be vulnerable. You just don't know what to expect. Most people, aren't necessarily repeat offenders, although when you do walk into treatment centers, you will find the frequent flyers as well, too. And those people kind of irritate me. And as a staff member, I'm not a huge fan. Not that I don't want you to get better, but if you're over here thinking you can show everybody the ropes and you're kind of setting bad examples and kind of thinking you're too cool for school, and you got somebody who walked in the door, 27 hours sober, and now they're kind of seeing you, it's not a great environment. Something else to keep in mind, there are male and female specific programs, and then there are co-ed specific programs. Right? So I don't know if I have a preference one way or the other. I did meet my wife when we were both going, my ex-wife. Well, if that doesn't tell you something right out of the gate, I don't know what does. When we were in treatment together, I get the benefit and the value of both ways, right? A male-only, a female-only program, you can just focus without some of the distractions. And many of us have used sex and relationships as a way to kind of cope and get through. And I'd be guilty of that as well, too. It's also, as a staff member who's seen both sides of it as well, too, if you start getting the co-ed thing and, those little relationships can bud, or they're sneaking off and doing this and sneaking off and doing that, what's happening is that they're using the excitement of the relationship to kind of, heal, mend, not feel some of that emotion that they need to be working on while they're in there. Well, Steve, didn't you do it? Yeah, and it probably set me back some, right? And the other part of this thing, too, is that, picture somebody, I don't know if I've said this on a previous podcast or not, standing up on a chair and me on the floor. Is it easier for that person to pull me up or for me to pull them down, right? Just think of that image. And in 100%, it is so easy for me to just yank them down. And when we're talking about life and death, and we are talking about life and death when we're talking about rehab and treatment and drug and alcohol addiction here, it is so easy to just pull someone down to your level. And you know what? Early on, who you're matched up with, your brain's not, literally your brain is not right. From the chemicals that you put into them to the poison that you put into it that we've now ripped away, and your brain hasn't reset. And by the way, that's going to take weeks and months and if not longer, to fully get back to whatever would be quote unquote normal. Just from a physiological perspective, the healing that has to take place. So jumping into a relationship, or even a situationship, whatever you want to call it, while you're in treatment, it can do a little more harm than good. Does it work every once in a while? Sure, maybe. I would advise against it. Well, Steve, aren't you kind of saying then you wouldn't suggest co-ed? No, not necessarily. I think you got to know. You got to know you. You got to know the program. And kind of take it from there, right? I can't bash it one way or the other. I can just share what I've seen both as a patient and as a staff member, and how people jumping into those things can kind of mask the pain because they can glom onto something, and it kind of helps them feel better versus dealing with the stuff that actually is there. So you're in treatment now. You've got your counselor. You've got your group counseling. You've done some arts and crafts. I am a big proponent, both as a staff and a patient, to get some exercise. If your facility has a gym, or if you're allowed to go for a run or go for a walk, find some way to physically engage your body when you're cleared medically to do that. If you have medical issues, please consult those folks before you just take off and think that you can just throw up a bunch of weight in the gym. But do it. Get moving. I mean, most of us were sedentary, not making healthy decisions. I'd try and, take a look at your diet, try and get moving. A little bit of exercise while you're in the treatment center, I think, is just going to overall help you get into a positive direction. Don't go crazy with it, but let's, I'd much rather see you get addicted to exercise than, addicted to meth. That's just, it's a little nugget from Steve Areno over here. Well, aren't you just trading one thing for the other? Sure, fine, cool, don't care. Good, this one's good for you. That one's terrible for you. So go for it, right? I don't care. Push back at me all you want. So you're in treatment. You're eating a little bit better. Hopefully you're exercising a little bit. One of the things that you're probably going to get exposed to, depending on the treatment center environment, is going to be Alcoholics Anonymous, 12-step program, call it whatever you want. Whether that's for you or not, I've seen it work literal miracles on people. It is something I've chose to use in my life that I have found as a safe place for me to go and connect with others, and also helps remind me on a regular basis of who I could be very quickly. If it's not for you, that's fine too. There's Smart Recovery, there's Celebrate, there's NA, there's CA, there's other types of programs altogether that are not 12-step type programs. Whatever one that you choose, try and keep an open mind while you're in treatment. Your brain got you into that bed at the treatment center, so maybe it's not in the best functioning shape possible. So if we can just take a step back and go like, all right, I hear this. They're talking about God. I'm not really into the God thing. No big deal. There's my yoga plug. Go get into some yoga. Try that. Use that as your spiritual kind of thing if that's what helps. I've seen that a lot of people in recovery go down the yoga route. Again, always wished I would have gotten into it a little bit earlier to help tame this beast. But whatever it is, try and keep an open mind. We are always so critical when we walk in. We know all the answers. That's dumb. I'm not going to do that. That's stupid. I tried that. It didn't work. Try and take a half a step back and just keep an open mind when people are presenting different ideas, and then evaluate what may work for you, what may not work for you. Other things in rehab that you're probably going to see, maybe they're going to ask you to keep a little bit of a journal or a diary. If they don't, I recommend it anyways. Writing's an interesting way to just kind of organize your thoughts and kind of share, especially when thoughts are just swirling, like I said early on. It's an interesting way to kind of document it. And then I've kept one, and I've read it from time to time over the years. Maybe pick up a book, whether that's an audio book or an actual book, and read something that you might not have read normally. Just keeping an open mind and trying little new things while you're in the treatment program. And I think it's also important to start to kind of make some friendships, right? I'm not saying these have to be lifelong friends, but there are many people that I went through treatment with that I still see in the rooms of the 12 steps today. I then went into an outpatient program. I've kept up with them over the years and have seen them be successful. I've seen them relapse. I've seen them pass away. But I do think it's important to kind of start to build a little bit of a community around you. I know that's easier said than done, but something to keep in mind. I still go to the same 12-step meeting that I've been going to for 20 years. I don't go as often as I did the first year, so, I'm not perfect over here, but I still see many of the same folks in that room. To me, that tells me something, right? That they're doing all right and they keep showing up. Something to think about. So you're making friends, you're eating better, you're trying a little bit of exercise, you're being vulnerable, you're being open to new ideas, you're trying to check the ego a little bit. What next? Stay as long as possible. Okay, just stay as long as possible. I know, well, Steve, it costs $30,000 a month. I know that's not feasible for everybody. If you're in an insurance program, and insurance just pisses me off, the length of treatment was determined by insurance, 28 days, and it's even less so often now. I mean, that wasn't set by some clinician that has research and a table and watched people. It was like, this is what we want to pay for, no more. And that's being less. If you can't stay, I stayed for 6 weeks when I was a patient there, and then I went back. Call it extendo treatment as an employee of the treatment center. Stay as long as you can, right? Stay connected. Everything in the world will still be there when you get out. Everything. What about my job? What about this? It's called FMLA, all right? Family and Medical Leave Act. I don't know the ins and outs of FMLA, but here's what I do know. If you file FMLA, they can't ask you what the heck you did. Just tell them whatever you feel comfortable telling them that you had to go away for a little bit and get better, right? They can't fire you for that kind of stuff. So you're protected with this FMLA Act. So spend time. Doctors will sign off on this. Take as long as you need while you're there, right? Now, here's a really interesting kind of wrinkle in all of this is the family component, right? Oh, Steve, you get to go and your treatment center has a pool and they cook you meals and I wish I could take a break for 30 days and talk about myself. I hear that, and not only did I hear it from my family and loved ones. Almost every single person that walked in the door of the treatment center, because the treatment center I was at here in Scottsdale was a nice facility. As treatment centers go, it has a pool. It kind of looks out at things. And okay, now, yes, maybe this looks, on the surface like an interesting, comfortable environment to get better at. I have no problem, having some creature comforts as you're really trying to work on yourself. But you weren't there when I hadn't slept for 4 and 5 days, or I was driving down to sketchy parts of town, or where I had a gun pulled on me and a drug deal gone bad, or you weren't. We earned our spot, and this isn't a badge or anything like that. But what got us here is not healthy, and trust me, you wouldn't want to trade places with me to do and go through the things and the suffering that I went through, all self-induced, no pity, not looking for sympathy here, to get me to walk into these doors. And also how I'm basically having to restart my life over again at 35 years old or whatever the age is again. Because that's really, in my example, I literally had to start over my life at 35 years old. So understand that your family is going to be pissed, they're going to be hurt, they're going to be resentful, they're going to be angry. And there's going to be family day, and they're going to come visit you in treatment, or maybe they're not, and that will be tough to process as well too. But be prepared that you're going to have to address all of that. Talk about it in your therapy, in your one-on-one counseling sessions with your therapist. Talk about it in your group settings, because you're going to be in kind of small group settings as well too. And start to prepare mentally, emotionally for those things. And understand that they're going to be mad. And they have every right in the world to be mad. And you know what they're going to do? They're going to say mean and hurtful things. You know why? Because you've hurt them a lot, repeatedly, over and over and over again. And you just don't know and have experienced firsthand the pain that they have because you were high and drunk for years on end. So understand that there's going to be a lot of processing and time and healing that it takes from them to start to accept you. If they do, and they may not. By the way, depending on what type of, real pain you were, there's a high chance they may want nothing to do with you. And that's okay on their part. That's a boundary that they're setting on their part because maybe you've burned them just one too many times, right? And you have to be able to respect that and also process it. I hope that's not the case. I hope that's not the case at all. But, I mean, look, when we're out there running and gunning and doing the things that landed us there, is a strong possibility. I was very fortunate that, my family still chose to support me. As they always say, it's, support the recovery, not the addict. And that is a true statement. And as long as I continue to kind of be actively involved in my recovery and make those positive decisions and life choices, I continued to have the support of my family. If I would have not, I know right where I would have been, and they would have cut me off, and, that would have been that. And again, don't blame them at all. So just be prepared that there is going to be some family baggage that comes along with this. Divorce, financial stress and strain. I see a lot of people get to divorce. I feel like I always talk about the guy's perspective. I just have a unique insight into that because I was one of those guys and saw so many of those guys that walked in the door. I'm going into rehab to save my marriage. My wife is leaving, kind of thing. She very well probably will still leave. Just FYI. I know. Yeah, well, then why do I need to go? Well, if you really want to get better and not die, that would be the number one reason you want to do it. But just because you check into a treatment center and walk in the door and you have a smile and you pick up your chips and you show them to your family and the loved ones and they clap and smile and cry and give you hugs and all that kind of stuff, doesn't mean that they're going to take you back. I mean, depending on who you were and what you did, those are very hurt people. And you gotta understand that, and it sucks, man. And I feel for you. I feel for you. I lost a marriage when I was in treatment. I remember, trying to kind of get that back as well too. And it was like, Steve, I'm really happy for you, but I want nothing to do with you. I'm like, oh crap, that hurts, right? I thought this, that, and look at me, good, and this would nope. So. Yeah, that's really tough stuff. Well, shoot, I had another great question, kind of, what to consider after divorce question come in. Some things like the not so obvious things that are going to pop up. I just don't think we're going to have time for that today. We might have to push that to next week. I just thought the rehab topic, give you a little, peek behind what actually is going on at the treatment centers is worth it. I strongly encourage people to get into a treatment center program. If you've been out there using and abusing, your body needs it. Your life will thank you. It won't be easy, but it will be worth it. So just really, if you're on the edge and considering it, put all those excuses to the side. Just, you're not unique. You're not special. If you lose your job, you lose your job. You're probably going to lose it anyways. Just get past all the excuses part so we can hopefully save the next 10, 20, 30, 40, 50 years of your life by investing in yourself now. There's a lot to unpack there on the treatment center. And again, if you have any more questions, or Steve, well, what about this or what about that? Is my girlfriend allowed to come? Yeah, you have family days and stuff like that. They can come and say hi. And if you're trying to sneak off and have sex or something like that, then you're probably going to get in trouble. So look, shoot me some questions on Instagram. That's where I spend the most of my time talking to folks about the unlicensed counselor, whether it's a direct message or not. I love to keep talking about this. It's a really important topic, one that I'm passionate about, as always. But I just don't think we're going to have enough time today to kind of get to some of the listener-submitted questions as well, too. So, rehab is for quitters. Boy, I saw that T-shirt, who knows how long ago, and it's always resonated to me. And again, the name of this episode came to me before I even had all my thoughts organized around it. So I hope you got something really valuable. This is an important topic. Do good for yourself. Check in. Don't think twice about it. My name is Steve Moak. I am the unlicensed counselor. Until next time, thank you very much.